If you wake up 2 or more times a night to use the bathroom, your body is trying to tell you something, and it's probably not what your doctor had time to explain at your last appointment. Science has already established a clear connection between prostate inflammation and diet. This is not theory. These are studies involving tens of thousands of men. I'm going to show you the 4 foods that appear repeatedly in those studies, from the most well-known to the most unexpected, and what happens to your symptoms when you remove them. My name is Dr. Thomas Ellsworth, and throughout my work following men's health, one thing has become very clear to me. Most men have no idea that what they eat is fueling the problem that wakes them up in the middle of the night. If you're not yet subscribed to this channel, do it now. What we discuss here can change the way you take care of your body. Before we talk about the foods, let me show you what's happening inside. The prostate is roughly the size of a walnut. It sits just below the bladder, wrapping around the urethra. When it becomes inflamed, even slightly, it starts compressing that channel. The bladder feels resistance. It doesn't empty completely, and that's when the cycle begins. Urgency, weak flow, a feeling of incomplete emptying, and those trips to the bathroom in the middle of the night that leave anyone exhausted. More than 50% of men over 60 already show some degree of benign hyperplasia with an inflammatory component. That is documented by the American Urological Association. And the detail that very few people hear is this: chronic low-grade inflammation, the kind that works slowly and without obvious pain, directly affects the receptors in prostate tissue. It feeds the growth. It keeps the cycle active. Have you ever stopped to think about what you eat for breakfast before a bad night? What you drink at dinner on the nights when things are worse? There's probably a connection you've never considered. The first food I want to bring into this conversation is processed meats. Ham, sausage, bacon, hot dogs, deli meats in general. Foods that are on the table of millions of men every single day at breakfast, as a snack, in a quick lunch sandwich. A study published in the American Journal of Clinical Nutrition, conducted with more than 11,000 men over 50, found something significant. Men who frequently consume processed meats have a 42% higher risk of developing severe urinary symptoms related to prostate enlargement, because these products are rich in nitrates, saturated fats, and additives that trigger inflammatory markers in the body. And the prostate, being a tissue highly sensitive to hormones and inflammatory signals, reacts. It swells, it compresses, and you wake up in the middle of the night. The substitution doesn't have to be dramatic. Eggs, canned tuna, avocado nuts, clean proteins that don't carry that inflammatory load, small swaps that over weeks your body begins to notice. The second food is sugar and refined carbohydrates. White bread, packaged juice, crackers, processed cereal, sugar in your coffee. It seems harmless, but there is a specific biological mechanism here that connects elevated glucose to prostate growth, and it runs through a hormone called IGF-1. When you consume excess sugar chronically, your pancreas produces more insulin. Consistently high insulin, what doctors call hyperinsulinemia, stimulates the production of IGF-1, and IGF-1 acts like a fertilizer for prostate cells. It drives growth. A meta-analysis published in Diabetes Care, bringing together 17 independent studies, showed that men with insulin resistance and chronically elevated glucose have 37% more prostate volume and report significantly more nighttime symptoms. swapping white bread for whole grain or oatmeal, cutting sugar from your coffee, replacing packaged juice with whole fruit. This is not a restrictive diet. It's removing the fuel that is feeding the problem inside you. The third food is alcohol. And here I need to be direct because there is a very well-established myth that 1 or 2 drinks a day are good for the heart and by extension for the body overall. The science has moved on. And when it comes to the prostate, the picture looks different. A study published in the Journal of Nutrition followed men over 55 and found that those who consumed 2 alcoholic drinks per day had 29% more severe nighttime symptoms and a visibly larger prostate on ultrasound. 2 mechanisms explain this clearly. The first is prostatic congestion. Alcohol dilates blood vessels. This increases blood flow to the pelvic region and causes pressure buildup in prostate tissue. The prostate swells. The urethra feels it, and the bladder responds with urgency. The second mechanism is the diuretic effect. Alcohol inhibits antidiuretic hormone, which is exactly the hormone responsible for reducing urine production during the night. Without it working properly, the kidneys continue producing urine at a daytime rate, even while you're trying to sleep. The result is predictable. You wake up, and you wake up again, 4 weeks without alcohol at dinner. That's all I'm asking you to consider as a test. Not forever, not as a punishment. As an experiment, pay attention to what happens with your nights. Many men are surprised by the difference, but take a breath. I know that cutting 3 things at once can feel like too much. And that's exactly why there's a practical sequence here, an order that makes sense for your body and your routine. I'll get to it. But first, I need to tell you about the 4th food. And this one is the most surprising: whole fat dairy. Whole milk, yellow cheese, butter, full fat yogurt. Foods that most people associate with health, with calcium, with strength. And that appear repeatedly in long-term studies as aggravating factors for nighttime prostate symptoms. A follow-up study conducted by Harvard University with more than 22,000 men over 28 years found a consistent association between high consumption of whole-fat dairy and a greater risk of symptomatic prostatic hyperplasia. Each additional daily serving was associated with a 16% cumulative increase in the risk of severe nighttime symptoms. 3 mechanisms are at play here. The first is the bovine IGF-1 present in whole milk, which acts similarly to insulin in stimulating prostate cell growth. The second is the liquid volume consumed close to bedtime, which overloads the bladder exactly when it should be at rest. And the third, perhaps the most important, is the effect of whole-fat dairy on active vitamin D. Vitamin D plays a regulatory role in prostate tissue growth. It acts as a natural brake. And high calcium intake through whole-fat dairy suppresses the conversion of vitamin D into its active form in the body. Without that brake functioning, prostate growth faces less resistance. Have you ever noticed that your nights get worse on days when you drink milk before bed, or when you eat cheese at dinner? Pay attention to that. Your body may have already been giving you that answer for some time. The practical substitution is simple. Replace whole milk with chamomile or ginger tea before bed. Reduce whole-fat dairy in your afternoon and evening meals. So if you want to keep some dairy in your diet, opt for plain unsweetened yogurt at meals during the day away from bedtime. And here's the part that really matters. It's not about perfection. It's about consistency. You don't need to eliminate everything on the same day. There's a sequence that makes this manageable, sustainable, and that starts showing results in weeks. And I'm going to show you exactly how to do it now. The practical sequence starts with what creates the most impact the fastest. And the order is not random. It was designed so that each elimination prepares the ground for the next. The first step is to remove processed meats from breakfast and snacks. Ham, sausage, bacon, deli meat. Replace them with eggs, canned tuna, avocado, nuts. Clean proteins that nourish without inflaming. Do this for 1 week and observe. Your body will start reducing its baseline inflammatory load before any other change takes place. The second step is to cut sugar and refined carbs at breakfast. Switch white bread for whole grain or oatmeal. Remove the sugar from your coffee or reduce it gradually. Replace packaged juice with whole fruit. This is not about eating less. It's about removing the hormonal trigger that stimulates IGF-1 and feeds prostate growth without you even realizing it. The third step is to eliminate alcohol at dinner for 4 weeks. Just that. 4 weeks of observation. Without alcohol at night, the anti-diuretic hormone returns to functioning as it should. Nighttime urine production decreases. Prostatic congestion reduces. Many men report noticeable improvement as early as the 2nd week. The fourth step, and the most important one for your nights, is to eliminate whole-fat dairy in the 4 hours before bed. This is the adjustment that most directly impacts sleep quality. No whole milk, no full-fat cheese, no excess butter during that window. If you want something warm before bed, chamomile or ginger tea. If you want to keep some dairy in your diet, choose plain unsweetened yogurt at meals during the day, well away from bedtime. 4 steps. 4 weeks of real testing. What the studies show is that men who consistently remove these 4 food groups report an average reduction of 44% in nighttime urinary symptoms within 8 weeks. This is not a promise. It's what the data shows when the inflammatory fuel is removed and the prostate tissue finally has the conditions to respond. Stronger flow, more complete emptying, less urgency, and longer nights. Not because the prostate shrank overnight, but because the chronic inflammation that was keeping it pressed against the urethra started to ease. This is documented, and what strikes me most after years following this field is how rarely this information reaches men in a clear and direct way. A doctor has 10 minutes per appointment. They prescribe the medication, adjust the dose, order the test. The conversation about diet almost never happens. Not out of carelessness, out of time. That's why this kind of content matters. Because you deserve to know what's happening inside your body. And you deserve real tools to change it. I'm not telling you to abandon your doctor or the treatment you're already following. I'm telling you that what you put on your plate every day is part of the equation, a part that is completely in your hands. And that starts showing results faster than most people expect. Start this week. Choose one of the 4 steps, just one, the one that feels most manageable right now, and keep it for 7 days. Then add the next one. Consistency does more than perfection. Always. Sleeping through the night is not a privilege reserved for the young. It's something your body is still capable of doing. Sometimes it just needs you to stop feeding what's getting in the way. Which of these 4 foods do you consume most often? Tell me in the comments. I read everything. You've already tried making a change in your diet and noticed a difference in your symptoms. Share that too. That exchange is valuable for everyone here. If this content made sense to you, leave your like, Share it with someone who might need to hear this, subscribe to the channel, and hit the notification bell so you don't miss the next videos.